who has a chronic illness, you know how much life changes. It is frustrating, especially when the symptoms become hard to manage. And it can cause so much problems in terms of family dynamics and personal freedom. Chronic illnesses continue to be a source of frustration. And that's what we're going to talk a little bit about today. This is Dr. Dwayne Wood. If you're new to me, that's Wood with an E. The E stands for endocrinology. And here on the channel, I educate, I empower, and I encourage you to take charge of your health, your life, avoid complications, and create the life you've always wanted, going to the next level. Welcome. This is our special edition, and we're talking today about chronic diseases. How are you coping with chronic diseases? Welcome. It's a Friday. Yay. And just so excited that this week has been amazing. I've had a good time this week, actually. We had some folks that were out at the office, but we got through the week and took care of patients, had a good time, learned a lot, and patients learned a lot. We did some good work, and hopefully you have done good work this week as well. And you are looking forward to the weekend. I know I am. Looking forward to the weekend. So this is our special edition, y'all. The last special edition we did some curry chicken. I don't know if you remember that. Go back and watch that on the channel. And we've got some other things that we are doing, that we're preparing, so that you guys can take a look at what goes on in our kitchen. But so glad that you're here. We should be streaming on all the different social media platforms. Of course, on our channel here on YouTube, but should also be out there on Facebook and TikTok. Well, not TikTok, Twitter and LinkedIn and even Twitch. I think we're supposed to be there right now. Okay. So make sure that you are there. Let us know that you're out there. Drop us a comment in the comment section. Give us a thumbs up if you're watching us right now, and let us know that you are able to see us. As I get ready for the weekend, I was outside last weekend doing some work in the yard, and hopefully I'll get out there. It's a little cold today, but it should be we should be fine, right? All right. Well, so like I said, chronic diseases, chronic illnesses, those are big things that happen in our society, in our community. We're going to show you a couple of graphics here in a minute so that you can see what we're talking about. But you have family members, or you yourself may be suffering from a chronic disease, and you know what it's like trying to deal with that chronic disease. Every individual has unique emotional responses to it, but there are some constants, right? Some common things that we see, and it's understandable that sometimes it feels like it's a chaotic time, particularly when something is newly diagnosed that we know is going to be a chronic disease, but we see it in our older patients, right? Because they've been living with it. And it's important to remember, and I'm going to say that up front here, and we're going to repeat this again, that this does not mean that life is over. There are some changes that we'll have to make, but it does not mean that everything is lost, right? So taking time to take care of yourself, establishing some healthy patterns, very important. So I wanted to make sure I say that. We're going to say it again, but as we go through some of the information, you may get the feeling that, oh my God, my life is done, it's over, I can't do anything. But no, that's not the case. So just want to make sure that you hear that from me. If you don't hear anything else that I say, I want to make sure that you hear that. So let's hop over. So chronic disease, and I'll put up a graphic here so that we can use that as the basis of what we're going to talk about. So chronic illnesses, chronic diseases, 6 out of every 10 people, let me say that again, 6 out of every 10 people persons in the United States, adults, live with a chronic disease. Do you know what 6 out of 10 is? That's 60%. So a lot of people are living with chronic illnesses. And I'm talking, and we hear about the big ones, right? We hear about heart disease, and we hear about diabetes, we hear about strokes and so forth. But there are other diseases that are out there. There are inflammatory diseases, rheumatoid arthritis, for example. And you guys hear me talk about that because it is I don't want to say the quintessential, but it is, right, a big example of things that are out there that we don't always talk about. People are living with osteoarthritis. Obesity, right, is a disease that we live with, and people are living with that chronically, which all causes other issues. And we'll kind of delve a little deeper and drill down a little bit to those. But it is it can be very frustrating for people because, and I had, I had people who I talked to this week who I had a young lady who came to see us. And the question was, what do we do? What do we do about all these things, right? So 4 in 10 adults have 2 or more illnesses, chronic diseases. And so not only are we living with a chronic disease, but we're living with multiple chronic diseases now. If we think back to years ago and not too distant past, much of the things that we suffered from were infectious. So when we showed up in the medical community and doctors were taking care of patients, a lot of what they were dealing with were infectious problems, right? So if someone got an infection, a virus, a bacteria, and then we are trying to treat that. And the thing that caused death in the past was not chronic disease, it was infections. And now that we've come forward, we are better at taking care of those infections, but we're now seeing that we have all these other things that are popping up that we are having to deal with. And so you'll see there at the bottom, right? So heart disease, cancer, chronic lung disease, strokes, Alzheimer's, kidney disease, diabetes. So those are the ones that we hear about all the time. But remember, there are a lot of other diseases that we don't necessarily hear about that are out there that are chronic, that people are living with. And sometimes, here's one, chronic pain. Right? So everybody's talking about the opiate issue that we're having. A lot of people are living with chronic pain, and one of the things that I see sometimes is that patients are afraid to become addicted, right? Because we're all talking about the crisis, and they're afraid of becoming addicted, and so they don't take pain medicines as they should because they don't want it to become an addictive issue. And so they're living with and pain in the hip, pain in the knee, pain in the back. So all those things are things that are out there that we don't necessarily talk about often, right? So the leading cause of death and disability in the United States is chronic disease, chronic illnesses. 4.1 trillion annually in healthcare costs. Let me say it again. You want me to say it again? Yeah, 4.1 trillion, y'all, in healthcare costs. That's a lot of money that we're spending on chronic diseases. And we keep throwing money into managing these diseases. And when we talk about the healthcare cost, right, that includes everything. So that includes cost of people who are having to be treated for their disease. So, for instance, if you have diabetes, the medications that you're taking, right, that's healthcare costs. If you have complications, you have to go to the hospital because you got an infection, a foot got infected. We have to have an amputation. We have to do dialysis. We have to do heart care. So stents have to be put in. We may have to do open heart surgery because the diabetes caused some issue with the heart. So all those things are included in there as healthcare costs. But not just that, but think about if you or a family member, or if you're an owner of a business, right, and someone is out, someone is out, that family, depending on, whether they have sick days or whatever they're paid, that family loses money because that's not it, that income is not coming in anymore. But also now, depending on how long they're out, we've got to go and find somebody to fill that position. Maybe you got to call a temp agency. And so now we're expending money for that person. And particularly if the person is getting paid time off because they're ill, right? That's part of the package that they have as part of your organization. So they're getting paid. And now we've got a temp person that we've got to pay because that temp person needs money, right? They don't come work for free. So when we think about all those monies that are being used for a particular person, $4.1 trillion annually in healthcare costs. Huge. That's a big one. That's a big thing, right? So lots of things there. So heart disease is the leading cause of death in the United States. One of the leading causes of heart disease is diabetes, right? And hypertension. Cancers are, it seems like every time we turn, we see someone who has a cancer. And remember, cancers are abnormal growth of normal cells, or actually it could be abnormal growth of abnormal cells as well. But basically abnormal growth of cells in the body, whether they're normal or not, right? It's a cancer. And the things that we do to our bodies, the food that we eat, the stress that we're under, all of those things can predispose us to cancers. Some environmental things, right, predispose us to cancers. Yeah. So we've got to make sure that we are, that we understand all of the things that are going on. Chronic lung disease, right? So smoking, big one. People who've been in industry and they've been exposed to certain things. So strokes, right? High blood pressure, predisposing to stroke. Cholesterol issues, right? So big issues. And then, of course, diabetes, right? So diabetes, we talk about diabetes all the time. Diabetes is one of those where, and I'll show you some of the graphics here in a minute, but just kind of preliminary, right? Talking about those things that we see that really do affect us here in the United States. And I'm saying United States, but around the world, we're seeing things, right? So when we talk about diabetes, 460 plus million people around the world who have diabetes. So it's not just something that we are that we see here in the United States. It's all around the world that we are being affected. Okay, we're being affected. So, and here's one. So diabetes, that's not diabetes, but chronic disease. I said diabetes, right? Because that's stuck in my head. So chronic disease, it doesn't respect people. It does not say, okay, you're of this race, so I'm not messing with you, or you are of this age, I'm not messing with you, or you are of this socioeconomic part of the community, right? So chronic diseases, chronic illnesses, it affects everyone. Now, there are some socioeconomic things that are in place that makes it easier or more difficult, depending on which part of the society you're in, to manage your diseases. And that's a whole nother conversation. And maybe we'll come back and we'll talk a little bit about that. But that's a whole nother conversation. But the chronic disease itself, it's there. And it's affecting everyone, right? So don't think that you are exempt simply because you live in a different place. Okay. When we think about the illnesses, right? So two big ones that I want to talk about. So blood pressure. So high blood pressure is a major risk factor for a lot of things that we see in chronic diseases. So high blood pressure. So 1 in every 2 adults has high blood pressure. That's 50%, y'all. 50%. And 1 in 4 has yet only 1 in 4 has a blood pressure that's under 130/80. Right, so those are some of the goals that we want to have. Right, so 50% of the adults have high blood pressure, but only a quarter of those that are in that group have numbers that we say, yeah, those are the numbers we want. Wow. Yeah, so I want you to think about that. So big issue. And then, of course, diabetes, right? When we talk about diabetes, and I mentioned the numbers, right? 460 plus million around the world, 37 million in the United States. And then I want you to look at that number below it, 96 million. 96 million people have prediabetes. Now let's pause there for a minute. So diabetes and prediabetes, very closely allied, right? So you get to prediabetes, then you get to diabetes. But the numbers for the diagnosis of diabetes versus prediabetes are so close that some of the people who are classified as prediabetes, they have the same complication, the same issues that are going on with people who have diabetes. So sometimes we think, oh, I'm pre-diabetic, so I don't have to do anything. I'm good. I can just keep doing what I'm doing. But no, there are complications, right? They can still have, for instance, let's assume that this is a weight issue, right? So because the weight is up, those people, even though they are pre-diabetic, they still have back issues and hip issues and knee problems, right? Because they're carrying around extra weight. Yeah. So just because they're pre-diabetic, because their blood sugar aren't as high as the diabetics, doesn't mean they don't have some complications. They can still be at risk for heart disease and still have strokes. They still have high blood pressure, high cholesterol. Right. So the phrase pre-diabetes sometimes gives a false sense of, I don't want to say hope, but a false sense to people. But we've got to be careful with those as well. Okay, so prediabetes and diabetes, and as we talk about all the chronic illnesses, we talk about the money, and we talk about, of course, the limbs, neuropathy, so you can have an amputation. We talk about blindness. We talk about kidney dialysis. Right. But there are some issues that we don't quite talk about as much. And that is quality of life. Let me tell you a story. So a lady comes into the office, right, patient. And she says, and we're dealing with her diabetes. She is diabetic. And she says, hey, doc, my blood sugars are high, and they were. And so we're talking about what's going on. And I'm trying to talk to her about blood sugar, but something else is on her mind. She's thinking something else. And so as I'm discussing blood sugar and checking your blood sugar and what you need to do and right, the eating and so forth, and she says to me, I really don't care. Essentially, I'm paraphrasing. And I said, what do you mean? Why? So she's maybe 75 years old. And she said, well, I used to be able to go out to the store for myself. I used to be able to run my own errands. And now I can't do that. And I can't do that because, and she'd had some complications with diabetes, and so she had some issues with her feet and neuropathy and balance, and her vision was also affected. And so her daughter, who's with her, has to drive her everywhere. So her issue really wasn't the blood sugar. When I say her issue, the thing that concerns her at the moment was not blood sugar. It was the loss of autonomy, the loss of freedom, because she felt like she was confined. And if I'm confined in her mind, If I can't do the things that I want to do, if my quality of life is not where it needs to be, then I really don't care. Do you know that depression is a major issue for people who have chronic diseases? Yeah. Because there's the social isolation that they have, social isolation that we don't talk a lot about. And what is social isolation? So this is, grandma used to be able to drive wherever to go visit grandson and daughter and son and all the people who are around them, or all the people in the family. And so now grandma can't do that for whatever reason, because something has happened in her life. And so she can't drive. And the family, not that they're ignoring her, but they're doing their life, right? They're doing life and they're busy. So they don't interact with each other as much. So she may see them once a week, as opposed to 3, 4, 5 times a week. And so there's this feeling of isolation and loneliness. There's a book, let me see if I have it. Yeah, so there's a book that I have that I bought, and I started giving to some of my patients, some of my older patients. And it's called, you may see it there, let's see. It's called The Story of My Life. The Story of My Life. And it's kind of a workbook, and it walks you through, and I think I've talked about it on my show before. It walks you through kind of recreating your life. So it asks you prompting questions, and you fill in, where were you born? What happened in the year when you were born? Can you sketch your house? Which room did you live in? How many brothers and sisters did you have? Who was your favorite friend? Did you have a pet when you were young? What was your favorite food? And so it's going through all these things, and very detailed, actually. And so by the time you're done, you have a pretty good record of your life. And so I started giving this, or I gave it a couple of patients in our office. And the reason I gave it to them was to keep them occupied, right? So they are now filling this in. I said, hey, write it in, fill the book in. And as you go through the book, call your daughter, your son, your grandson, whoever, and talk with them. So now they have a place or a point of connection. So I may not be seeing you, but I'm sharing information. So very, very effective, right? So I've had a lot of people who come in and say, hey, yeah, doc, that was a good thing that you did, and so forth. Okay. So isolation and loneliness. So disabilities. So the loss of use of a limb. If you have chronic hip problem, you can't move around the house as you normally did. If you have knee problems, if you have some problems with your hands, you've got neuropathy, you decrease grip strength, you can't open jars. Can you imagine? And we don't think about all those things. One of the most common things that we see is fatigue. So chronic illnesses cause fatigue. Chronic illnesses cause fatigue, that we don't think about those things. So I can't tell you the number of people who come to the office who talk about fatigue. And they're like, hey, something is going on, and there may not be anything happening. There may not be any other issue other than the chronic illness, the chronic disease. Yeah. I'm hearing a sound. Do you guys, if anybody's out there, do you hear another voice? It's in my head. It's very like a whisper, almost like I have a phone or something going on, but my phone is off. Anyway, right? So disabilities, fatigue, pain and discomfort, like we talked about, and the anxiety. Right? As we get older, the anxiety. Can you imagine being a person who, you were out there, right? You were doing your own thing. You took care of yourself. You went to the store and you worked all your life. And then all of a sudden somebody tells you, hey, you can't drive. Or now I'm spending money on my illness, right? We said 4.1 trillion, right? So part of that is your money. So you're spending money now on medications or supplies for a disease, and that money can't go to pay rent or can't go to buy food or can't go to buy clothes. And so as you're thinking, you're like, oh my God, what am I going to do? So anxiety goes up, distress goes up. And then if we're not careful, now we've got anger, hopelessness, frustration, anxiety, depression. Yeah, all those things there. And those are the things that we talk about when we talk about quality of life. Quality of life. So what is my life like? And as you get older, you start to think about, I mean, not that you don't think about it when you're younger, but now you begin to thinking, hey, wait a minute. How am I going to function? How am I going to get around? Is somebody going to be there for me? So big things that people have to consider when they're talking about chronic diseases, chronic illnesses. What's interesting is that programs that are around, the government has programs, the CDC has programs. For example, this one here that I'm going to show you, the CDC has a program called the National Diabetes Prevention Program. It's a lifestyle change program. And people learn in the program to make healthy food choices. They learn to be more active, more physically active. They find ways of coping with stress. And when they have people through the program, I want you to listen, hey, right? So they've been able to cut their risk of developing type 2 diabetes by as much as 58%. By learning to make healthy choices, by being more physically active and finding ways to cope. Finding ways to cope. That is incredible. That's incredible. Hey guys, hold on a second. Let me do something here real quick. All right, so I am back. Yeah. Just trying to figure out where that sound was coming from. Okay. All right. So they've been able to cut the development of diabetes by 58%, almost 60%, y'all. And that's huge. And that's by making some simple lifestyle changes, some simple lifestyle choices, and dealing with stress, right? And stress is a huge one. Stress is a huge one. So what we're doing in our office is we're working with people to say, hey, how do we make sure that we're getting, for instance, blood sugars under control? And we are making a big push this year to say, look, we've I say I'm about to get into a big conversation. So people are frustrated with blood sugars. The statistic says that for every year that someone doesn't get blood sugar control, the likelihood of getting control decreases. Because over years and years and years, people are frustrated. People are frustrated. Because they see they're being told hey, we got to get the numbers good. We got to get the numbers down. All these things. And how? And we say lifestyle changes. What does that mean? So anyway, in the office, we're making a big push. We got to get numbers down. And people who are coming in with numbers that are way out of control, there are some drastic things that we've got to do in terms of medication and get them through. And then, okay, now we've got the medication on, we got the blood sugar. So we've put you can think of it kind of like a dam that's breaking. So we've stopped the dam from breaking, right? We've kind of patched that hole, but that water is still there. And so we've talked, hey, let's get these blood sugars under control. And okay, now what do we do? How do we move forward in making sure that that we can decrease the force of that water that's coming, basically with that dam example, okay? So those are the types of things that we've got to do. And if we can do that, if we can make those lifestyle changes, all those things we talked about, the depression, right? And if you're out there, right, you are in connection, you are in the space with your folks, with your loved ones who are having these issues. And mom is a little bit more depressed, and dad is a little bit more depressed because they're not able to get about. Right? They were the ones, they used to be able to do whatever they wanted. But now they're confined. Loss of autonomy. They're anxious. And not just, like I said, diabetes and thyroid, diabetes and hypertension and cholesterol and strokes, but all those other diseases that are out there that are inflammatory, that cause pain. And sometimes we just don't feel well and we're not quite sure. And so you want to make sure that you're talking to your healthcare providers. Okay, let's get these sugars under control. Let's get this blood sugar on this blood pressure under control. How do I go about? What are some things that I do to help work on my weight? How do I get good sleep? Because remember, sleep causes stress. Stress causes cortisol to go up. Cortisol elevates blood pressure. Cortisol causes other issues, right? So mentation, you can't think properly. You just don't feel good. So when we talk about chronic diseases, there's so many aspects that affects our lives across the board. And we got to make sure that we're getting those things under control. And one of the things that I'm excited about is a program that we are doing called Sugar Busters. Sugar Busters with Dr. Dwayne Wood. Sugar Busters. It's a 14-day time to learn about one of the major things that we can do to improve our lives. First of all, to help decrease the chances that we get into some of these chronic illnesses, right? So decreasing, learning about sugar, where sugar is and what it does to the body, how the body uses sugar, so that we can decrease the progression to diabetes and obesity and pre-diabetes and all those things that come from having too much sugar in the diet. Like we talked about, prior to now, we died and we had diseases that were based on infection. And now we're seeing these chronic illnesses that are based on our lifestyle. And you can't have a conversation about chronic disease without sugar coming into that conversation. You know, from the time we started developing sugar from cane way back in the day, right? And now we've got sugar beets, and we've got so many other ways that we are getting sugar or getting sweets. If you saw one of my promos, I said, I've been taking care of thousands of patients over my career, and I've never had somebody say to me, "Hey doc, I woke up and I had a craving for broccoli." That just doesn't happen. But what do we crave? That's right, we crave the sugar, y'all. We crave the sugar. And let me give you an example. If we're taking in more sugar, okay? And we tell people, hey, you got to keep blood sugars under control. We'll talk about diabetes here in a minute, for this minute. We got to keep the blood sugars under control. So if you take in more sugar, whatever the sugar is coming from, you got to treat it. Makes sense. And so how do you think a lot of people treat it? Well, they drink water, they exercise, and they take medication. So those are 3 ways to bring blood sugars down, by the way. There's not another way. Now, you can prevent it from going up by watching how much you eat. But the only ways right now, if your blood sugar is high, to bring that blood sugar down is either to drink warm water, exercise, or take medication. Regardless of what anybody tells you, that's it. And so they eat a cookie, they eat a donut, they drink some coffee with some sugar in it. And they exercise a little bit, but they don't exercise enough for the sugar that's in the thing they just ate. And they drank some water. So inevitably, they're going to need to take some medication. Let's assume they're on insulin. So they take some insulin now. And the insulin does bring the blood sugar down. But insulin itself has complications. So insulin causes weight gain. Insulin causes you to be hungry. Insulin causes, the more insulin you take, you got insulin resistance now. Right? So now we've got this cycle that's going. And so Sugar Busters helps us, identify, what are the things that we need to do to begin working to cut that back from our diet? Where are they? Sometimes there are hidden sugars that are out there somewhere. Where are they? What do we do with them? Not only those diseases, but inflammatory diseases. Right? We tell people, hey, we want you to stay away from pro-inflammatory things. Like what? Well, refined sugars. Right? Refined sugars. We want you to stay away from those. And so Sugar Busters is a place where we are going to come together. It's 15 days starting on March the 15th. The kickoff is at 5 o'clock. We've got an early bird special that's going on right now that's good until March 11th. That's tomorrow night at midnight. And then the price goes up. Right now it's $19.99. If you're getting that early bird special, it's $19.99. And then after tomorrow at midnight, after midnight tomorrow, I guess I should say, it goes up to $49.99. So you want to make sure that you get in there. If you don't get the early bird special, you got to be there with the regular price, right? But you got to be there somehow, right? Because you are going to not only be in the space to begin learning about sugars, it's going to be fun. So this is not just us lecturing. This is going to be fun. We're going to be having some challenges in there. And you're going to have the community of people that are trying to do the same thing. I'm going to be in there talking, having some fun with you. And yeah, you get to hang out with me for 14 days. Well, not a whole 14 days, right? So I'm in the group, with you. But yeah, I keep saying 14, but it's actually 15 days, y'all. 15 days. So Sugar Busters with Dr. Dwayne will kick off March the 15th at 5 p.m. Central. Early bird special right now, $19.99. And you want to make sure that you are in that space. Get your seat. And it's Dwayne Wood MD, DwayneWoodMD.com/Sugar Busters. DwayneWoodMD.com/Sugar Busters. And I don't know why that's not on that screen that I just showed you there. So let's do this. Sugar Busters. Let's pull it up here. This is our website. Let me see if I can pull it this way. Okay, yeah, there you go. So DwayneWoodMD.com/Sugar Busters. All right, there it is. Sugar Busters with Dr. Dwayne Wood, and we're counting down, y'all. 5 days, 1 hour, 30 minutes, and 27, 6, 5, 4 seconds, right? You just get over there and you click to reserve your spot now. You want to make sure that you do that so that we can decrease the chances of progressing to diabetes. We can decrease our weight. We can learn how to control those cravings, right? We can help with cholesterol, right? Where do you think cholesterol comes from, right? We all talk about the fats in our food, but probably the major source of fat is sugar, because our body converts it to fat. Right? So we want to make sure that we are doing the things that we need to do to be sure that we do not have those complications. Make sure we don't have those complications, y'all. Because we've got lots of time. And one of the questions I ask people in the office is, I say to them is, who is the oldest person in your family? And they'll tell me, mom or grandma or somebody. And I say, how old are they? I say 90 years old. And this person who I'm talking to may be 50 or 40 or 39. Right? If they're 50, I say to them, we have 40 more years to protect. Because if everybody in your family is living to be 90 years old and you're 50 now, you get it? So 40 more years of protection. That's what we're protecting. We're not just talking about, you don't have to pay money for medication or you won't have whatever complication. We're talking about 40 years of your life that we are investing in, that we're making sure that we protect. And that's that's nothing to sneeze at. So that when you get to that point, you're not feeling isolated. You're not feeling like you've lost autonomy. You're not struggling with depression and the loss of use of a limb or some other thing that you want to do. So that when you feel like you want to get up and go to the grocery store or get up and go to wherever, you're able to do that. You don't have to wait for someone to come to pick you up to go there. You're not dependent on their schedule because you have autonomy and you are healthy and you're able to do all the things that you want to do. And one of the major ways of doing that is learning how to deal with the excess sugar in our diet. If you're struggling with some inflammatory issues right now, one of the things that you got to learn to deal with is the excess sugar in the diet. Because those refined sugars are pro-inflammatory. When I say pro-inflammatory, I'm talking about they make pain worse or they make inflammation worse. Sorry. They make inflammation worse. So making sure that we're looking at those things, making sure that we're cutting back. Where are they? How do we deal with them? How do we deal with the cravings? Like I told you, people waking up, they're not craving broccoli. They're craving the cookie and the chocolate and the donut. People will drive across town to go get something. Order stuff on Amazon at 3:00 in the morning to get something because they've got that craving. And this is, I'm not talking about this from, something I heard, y'all. I'm telling you me. Right? I'm telling you me. I have a friend who I was sitting, we were in our house. He came to visit and we were talking and I got up and I went to the refrigerator and I got some juice. and I drank the juice, y'all. And he said to me, he said, I've never seen anybody drink juice like that. And so I started describing to him when I was drinking the juice what it felt like. I mean, if you close your eyes, the smoothness of the juice going down, it's cold, and the sweet on your tongue. And he said, I've never had anybody describe drinking juice like that. So when I talk about cravings, oh yeah, this is not something I heard, y'all. This is something that I live. I got another friend who I think is kind of like me. I won't put her out there like that. Right? But yeah, it's a real thing. It's a real thing. I mentioned to someone recently that, and you guys know that I am a diabetic. And I remember, well, not remember, but I had drank some juice, maybe eaten a cookie or something. And so I took some insulin. And within the space of 7 days, people, I had put on 10 pounds. So what do you do if you're treating diseases and that's what you're battling? And that's what we're going to be talking about, some of those things. How do we deal with that stuff? Where does it go? What do we do? What do you do at night when you wake up and there's that struggle? And, you know, those two things in your head, right? Kind of like the good angel and the bad angel. the don't do it angel and the yes, I won't do it angel, right? So yeah, we got to deal with it. We got to deal with it. And it begins by understanding how the body uses sugar, how sugar works, where is sugar, and some of the things that we can do to prevent it. Hey, what's up, Jeff? Jeff. Hey, let me put this up. Jeff says, hey, Doc, are you type 1 or type 2? Hey, I'm type 2, man. Yeah, yep. Thanks for coming through. Let me give you that's our little music. Thanks for being here, kind of thing. Jeff is Jeff. I love when Jeff comes on. He's always commenting and looking at our stuff. So Jeff, thank you for all of your support. I really appreciate that. He says me also. Yeah. Yep. There's a lot of us there, man. There's a lot of us, and that's why I'm so passionate about this stuff. Because I get up every day and I live it. I live the process. So as I'm talking to you, all the stuff that I teach, this is stuff that is bolstered by my experience. This is stuff that comes from my living and understanding the struggle. And spending time over the next, starting on the 15th, spending time in Sugar Busters is going to be a way to begin working on that. Right? Remember, once again, early bird special, y'all, is right now. And midnight tomorrow, we go up to the regular price. Right now, $19.99, and then after midnight, $49.99 is where we're going to be. But either way, I'd love for you to get in on the early bird special. And if you're trying to make a decision about what to do, whether you should do this, whether you should not, we're talking about 14 days of spending time working on protecting years of your life. And protecting the quality of your life. So that's what we're talking about. So make sure you get out there, DwayneWoodMD.com, DwayneWoodMD.com/sugarbusters, DwayneWoodMD.com/sugarbusters. And if you know, if you're watching this and somebody else in your life is not watching this, and you know that they need to be watching this and they need to be in Sugar Busters, make sure you send them this video, send them the link. Let them know that they need to be there. They need to have a seat in that program starting on the 15th of March. That's next Wednesday. Kickoff is at 5 o'clock. I'm excited. I'm excited about it because I think we're gonna have a good time. We're gonna have a good time. We're gonna learn. We're gonna get healthier. This is the last month of the first quarter, and if you're out there, you have made, whether it's a resolution or a commitment or something that you plan to do, that I'm going to take charge of my health this year. This is it. This is a start. So it's the end of the first quarter, the last month in the quarter. But you want to be there. And so don't let another day go by without you. And that's what I say, right? When I start the show, and you heard me say it here today, I educate, I empower, I encourage people to take charge of their health, their life, avoid complications, and go to the next level, create the life you want. So this year, we're not letting anything happen. We're not letting anything happen to us. We're taking charge, right? Now, you may be down the road a piece in terms of you have already had some complications. You've already had some dialysis. You've already been told that you have some chronic kidney disease. You've already had some eye issues. You already have some neuropathy. That doesn't mean that it's the end of the road. So being in this space helps you to delay and or prevent the progression. Right? Notice what I said: delay and or prevent progression. So you want to make sure that you are there. If you don't know how to do it, then get somebody to help you. Get on there, DwayneWoodMD.com/sugarbusters, DwayneWoodMD.com/sugarbusters, to make sure that you get your spot in the space, y'all. Yep. So if you get in there, so we're going to do some challenges, right? So each day you're going to have a challenge. So I'll come in the group and we give a challenge, and then you have 24 hours. You have until the next day to do it, to do that challenge. And you will, in the group, we'll talk about what you're doing. You can share that there. People will comment, and you'll make some friends, and you will get the support. You'll learn about sugar, learn where they are, learn how we can begin combating those cravings. Yeah. And so preventing those things we talk about, the isolation, the loneliness, the loss of autonomy. Big. The depression that comes with this. All right, so make sure you are there. Make sure you're there. So tomorrow night, the 11th, is when the early bird special goes away. So you've still got time to get there and to become a part of the group. And I'm in there. I'm in there with you. And we are all learning, and we are all having fun, and we are all getting healthier together. All right. So once again, DwayneWoodMD.com. DwayneWoodMD.com is the website, /sugarbusters, and starts on March the 15th at 5 p.m. Central is the kickoff. You've got until tomorrow night at midnight, the March the 11th, to get in on the early bird special. And after that, we go up to our regular price of $49.99. But I want you to be there. I'm excited for you. I'm excited for me that I get to meet with you, that I get to partner with you, that I get to be in the space to help you take charge of your health in your life. I love this. If you guys watch me, I have fun when I'm doing this stuff, right? Because I am conveying to you stuff that I am learning. I'm conveying to you stuff that's going on in my life. I'm conveying to you the benefits of being an endocrinologist and being a diabetic and taking care of thousands of patients and learning from them over the years. That's why I get so excited when I do this stuff. Let's see. So Jeff says my Libre keeps me accountable. Yeah, Jeff. It does. And it tells on me sometimes. So when I'm in the office, I have to make sure that so sometimes I leave my phone on the desk somewhere, and I'll hear it beep, beep. And I got to run and say, okay, oh yeah, that last piece of whatever, I shouldn't have done that. So, all right. So DwayneWoodMD.com/sugarbusters is where you can sign up for the Sugar Busters with Dr. Dwayne Wood. Sugar Busters with Dr. Dwayne Wood. And then 15th of March is the kickoff, y'all. And make sure that you're there. Share this with someone who is in your life who you think needs it. Share it with everybody, right? And let them decide if they need it. But if you know someone who definitely needs to be in this space, go ahead and talk with them, help them to get signed up. And we will see them there. And we will begin taking charge of our health. And as we look down into the future, that anxiety, the loneliness, the loss of autonomy, the worry that we have about the money that we're using to treat illnesses, those are things that we can begin dealing with over the next 15 days. Just a lot of stuff packed in there, a lot of fun things, and that we're going to be doing, but a lot of learning. And if you begin taking charge of your health, the amazing ability, the amazing feeling that you get of having some control, you can't pay for that. So make sure that you're there. We will see you. We'll see you next week. But we got shows that are coming up between now and then. So we'll see you on the show. But definitely I want to see you in Sugar Busters with Dr. Dwayne Wood. And Jeff, hey man, thank you for coming through. I really appreciate that you that you're here always. And just a quick shout out to you all, as we talk here. Make sure that you are taking care of you and everybody else out there as well. And we'll see you when we see you. Thanks. This is Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health. Avoid complications. Create the life you've always wanted. And now we're adding a new word, connection and community. Connection and community. And that's what we're doing on the 15th. Have a good one. We'll see you later. Bye-bye.